Hello, my name is Amy Sturkey. I am here with my co-instructor. This is Winston, and he is 3 months old tomorrow. And we're talking about a series with torticollis. Winston does not have torticollis, but we are trying to teach things that you can do or be aware of if you have a child with torticollis. One of the things I pay a lot of attention to is symmetry. I look to make sure that when a child is in different positions that they are equal on both sides. Hey! And so one of the things I look at, and often I see, is that when they lay on their back, that they're off to one side. So let's get him laying on his back. Whoop. And when I look from his nose down his body, he's laying relatively straight. When I see children with a torticollis, it's not uncommon that their legs are off to one side relative to their trunk, that they have one side shortened and one side long. I'll actually take a measurement with a goniometer to see how uneven they are. So will then teach the families how to lengthen out that whole side if that's the case. I'll also look at their symmetry when they're laying on their stomach. So sometimes kids who have a torticollis only have their weight off to one side or only have their weight off on the other side and only use one arm to hit and play with and not the other one. And so I will encourage the other arm and weight shift. So for example, I had a child just this week who wanted to keep their weight on the right side and only play with their left. So I helped encourage them to weight shift to the left and play with their right. But I look really in detail at the symmetry to make sure both sides are the same, that their weight shift is the same and the reaching is the same when they're on their stomach. In sitting, you want to make sure that they are symmetrical. You want to make sure that they are not shortening one side like this or shortening the other side like this, that they that they can be put on either side easily, that they're not weight shifted one side all the time. So in sitting and standing on their stomach and on their back, you want to look at their skills, and if there are things they're having trouble with, or if one side is short, you want to lengthen out the side that's short. We'll show you that on a future video. I hope this is helpful for you. And just look at that symmetry with your children to make sure that they're doing the same on both sides and they're not leaning off on doing the same on both sides and not leaning off to one side. So here I have him standing and he's pushing off with both legs equally. You want to make sure that they're not shortening on one side or only pushing with one leg and not pushing well with the other leg. Winston is pushing well with both legs and his head is more or less centered over his hips. I've had other children in the past who, when I had them upstanding, had their shoulders off to one side, their hip to the other side, so they were not standing up straight and it was hard to correct them. I just want you to look at your child in the different positions, sitting, standing, on their stomach, and on their back, and make sure that they are not short on one side and long on the other side, or they're not using their hand as well in one position, or using their legs as well in a position. You want to make sure that you address those differences. I hope this is helpful for you, and I look forward to seeing you next time. Thanks a lot. Bye-bye. If you liked this video and would like to be notified by email when the next video comes out, click the subscribe button here and click the golden bell icon and ensure notifications are enabled on your account.